the full can raise. Patient's gonna start at 30 degrees of scaption with their thumbs up.
Thumbs up.
Thumbs up, and then an EMG study in 2023 found that 30 degrees of scaption and the scapular plane produced the highest supraspinatus to deltoid activation ratio.
Very hard.
This is the sideline external rotation exercise at 0 degrees of abduction. We're gonna have them elbow flex at 90 with a towel between their arm and body and have them externally rotate. A study done in 2014 showed that the sideline external rotation produced the greatest percent of maximum voluntary isometric contraction of the infraspinatus.
Yeah.
Mm.
This is an EMG study to test the strengthening for the teres minor. So the patient is going to lay face down on a table, and they're going to bring their arm up into 90 degrees abduction, like a field goal position. And then what they're going to do is they're going to externally rotate as far back as they can go, and then come back to that neutral position. And they can progress this further with weights. It can start as an isometric and then can get progressively harder.
Yeah. This is the belly press isometric with the band. We're gonna have the patient try to internally rotate their arm towards their belly button against resistance. And this was a recent study done in 2025 by Kim D, showing how the belly press produced the most sensitive subscapularis activation while minimizing shoulder muscle activity. This is for the rhomboids. We're gonna have them perform a row variation, emphasizing scapular retraction. We're gonna have the patient with their hand on the table and then about 45 degrees to the floor with their torso, and they're gonna just row and retract their scapula. This was a study done by Berkmans that found that this exercise shows 25 to 45% maximum voluntary isometric contraction.
This is an EMG-based study that's effective in activating the middle trap, but also touches a little posterior deltoid. It's a reverse fly. The patient's gonna lie face down, and they're gonna lift the weights out to the side and focus on pulling their shoulder blades together. This is an EMG-based study for activation of the lower trap, and they are Y raises. The patient will lay face down and have their thumbs up and lift their thumbs above their head, or equal to their head.
This is a strengthening exercise for the pec minor, and it's EMG study verified. So the patient's gonna start by facing the wall, and their arm's gonna be about arm length away from the wall. They're gonna place their hands on the wall at shoulder height, and then they're gonna bend their elbows to form a regular wall push-up. To stress the pec minor, when they come back out of the starting position, they're gonna keep pushing through their hands so that their shoulder blades move forward and apart, which is scapular protraction.
This is an EMG-based study for high activation of the serratus anterior. It's a pec punch, and the patient's gonna have dumbbells in their hands. They're gonna lift it above their head and focus on protracting their scapula and lifting their shoulders above the table.